Hello guys, welcome back to my channel. Today I'd like to talk to you about 5 chemo side effects that nobody talks about. Stay tuned. Hello guys, welcome back to my channel. If you're new here, this is me sharing my journey through breast cancer. Today I'm going to talk about 5 chemo side effects that no one talks about. Now before I proceed, I'd like to put this disclaimer here. Everyone's journey is different. So these are the 5 side effects I had from chemo, which no one told me about. Now, without wasting time, let's move on to the first. Number one, chemo belly. I had mentioned chemo belly on one of my videos. I will put up the link up here. Chemo belly is a phenomenon which happens when you're going through chemo. This happens because as chemo destroys the fast growing cells in your body, it also destroys the good and healthy bacteria in your gut. Those healthy bacteria are what help push food that you eat down through your digestive tract system. When chemo destroys this bacteria, what happens is you eat food and it doesn't go down as fast. So it makes you bloated, it makes you uncomfortable, you have a hard time going to the toilet. It makes you bloated even to a point where it could also be painful, and that makes your stomach big. Right up until now, I'm still struggling with getting my stomach back to the way it was. I can show you here, you can see a few pictures or videos of my tummy still quite big from this side effect of chemo. No one told me about this, not the first time I had cancer, not the second time. So it may or may not happen to you, but watch out for it. If you notice that you're bloated or that you're having a hard time going to the bathroom, no matter how much water or vegetables and fruits you eat, then you're probably having chemo belly. You should ask your doctor and they might give you more information on that. In my case, even I had mentioned it to one of my siblings who is in the medical field and he had never heard of it. He also had to go and do some search on Google. So, number one, chemo belly. Watch out for it. Number two, side effect that chemo has on you, which no one talks about, is your skin becomes sensitive to adhesive tape or band-aid. Now, I say this to specific products because that's when I noticed them when I had this on my skin. So when I went for blood tests or had an IV to do a scan, the area where they inserted the needle, they'll always, after they take it off, they cover it with um, uh, either tape or a band-aid. And each time I took the tape or the band-aid out, I will realize that my skin, a very thin layer of it, came off and stuck on this tape or band-aid. And it's something that had never happened to me before. It was quite new. I have a picture here. You can see where in the middle you see the skin is normal. That's where the gauze was put. And then you have the sticky part of the band-aid or the tape on it. That's where my skin came off. Sometimes it will get really red, like on this picture here. This is when I went to have the MRI test and they had to put an IV on me. After they took it out, they covered it with a band-aid, and that's how it got red. It got itchy sometimes, but sometimes the skin just came off and it got dark, and it would take a very long while to come off. No one told me about this. I never knew it happens. Anyways, watch out for that. Number three is blood pressure. When you're diagnosed with cancer, of course, it can get very traumatic. if you get anxious, anxiety, or knowing that you have to take chemo gets you worried. And of course, when you go to take the treatment, your blood pressure goes up. They will tell you, oh, it's because you're probably anxious, or the fact that you're in this room, the room where patients receive their chemo treatment, the fact that you're in here makes you tense, makes you anxious, and so it's normal that your blood pressure goes up. Sometimes, even for some patients, like myself, I took trastuzumab or Herceptin. It's the same product. Taking that particular medication might have an effect on your heart, and your doctors will get you to see a cardiologist to have that checked up, making sure it doesn't affect your heart, because if it does, they'll have to stop the treatment. But they do a regular check. If nothing happens, they keep giving you the treatment until you're done with the course that they have for you. Now, I did that all the time, and my heart, pardon me, my heart was fine. Every time they said it was good, and I took all the number of trastuzumab I had to take. But my blood pressure got high, even when I wasn't in the chemo room, even when I was not in the hospital. Even after I've been all through the treatment and everything is fine, my blood pressure kept going up. In fact, they're monitoring me now because I had blood pressure as high as 170 on 105, 166 on 100. I mean, no one tells you that your blood pressure might keep being high. And this is as a result of the treatment that you've been going through, the chemo, the cancer, and everything that has an effect on you. So keep an eye on your blood pressure. This is something you'll want to watch out for, and make sure that you're taking the right medications if need be. It will help. This is an example of a video I took to show you how high my blood pressure has been even after the treatment and everything. I had to use the teddy bear to support the screen so you can see it properly. And I had to sit down for a bit and relax, because you're supposed to be in a relaxed position before you take your blood pressure. So this is me putting it on. Now your blood pressure is supposed to range between 120 on 80. I think that's it. I'm not in the medical field, guys. This is just what my doctor told me. A plus and minus 2 or 3 here and there should be okay. Considering all that you've gone through, it could be a little high, which is still acceptable, between 130 to 35 on 80 to 85 should be acceptable. Look at that, guys. It was really high, 175 on 106. Number 4 is what I call burnt veins. So if you're going through chemo treatment and you start realizing that you have like a dark coloration on your skin that takes the shape of the veins in your arms, you're probably having burnt veins. This is something that happens to some patients, but not to all. As you can see on this video here, I was asking the nurse about it, and she confirmed that it happens to some patients, but no one told me about this. In my case, I had it and it was really bad. If you look at my arm, it was like someone burnt me, but it's in the shape of the veins. And it takes another long while to go. I didn't take a picture of it myself. I didn't remember to take one, but this is a photo here of what it looks like. I have another picture right here. You can see if you look keenly of my own arm, but there, that's when it just started, so it wasn't really clear. And I actually cropped this from a bigger picture here to be able to show you. It was really bad, and you just notice sometimes even they won't be able to put the IV in your arm on those veins because it's going to be hurting. This is something no one told me about, so you might want to watch out for that as well. Number 5, the last but not the least, dental care, your teeth. When I had to take chemo, my doctors asked me to change my toothpaste and take a toothpaste that has a low fluoride content in it. Now, they told me this because one of the side effects of chemo is the sore mouth. And when you use toothpaste with high fluoride in it, it makes those sores worse. So if at all you do have chemo and one of your side effects is a sore mouth, it might be good for you to reduce your fluoride. But what they don't tell you is that reducing the fluoride content in the toothpaste affects your teeth because chemo destroys your teeth. When I was done with my chemo, I went for a dental checkup and I had 10 of my teeth that needed feeling. I was so surprised because my teeth are generally very okay or healthy, maybe one or two here, but 10 at a time, it wasn't something that had happened to me before. So I asked the dentist, and she explained to me, or when I told her that I had been receiving chemo, she explained to me that I was supposed to have a toothpaste with a high fluoride content to protect my teeth from the effect of the chemo. Now I understand my doctors meant well to help me not make sores worse if I told I had sores during chemo. So they asked me to reduce the fluoride. But reducing the fluoride makes your teeth at risk for dental issues. So if you're going through chemo, speak to your dentist. They will recommend to you a toothpaste that has a high fluoride content that will help protect your teeth, but also help avoid making your sores get worse if at all you have sores as a side effect during chemo treatment. So those are the five side effects that I had, which nobody talks about from receiving chemo treatment. If this helps you, don't forget to share so that anyone who is going through this might also learn about this and take precautionary measures or not be surprised when they have this effect. The more we share, the more we are able to get people to hear this and be encouraged as well. Remember, God's got you, God's got this. Take care, guys. God bless you. Love you. Bye.